everyone, welcome to this concept capsule. The idea as always remains the same, decoding the high-yield MRCOG concepts in less than a minute. And today's topic, Intrauterine Growth Restriction or the IUGR. Now what is this? This basically refers to low birth weight infants whose birth weight is below 10th percentile of the average for that particular gestational age. So this refers to a fetus that has not reached its genetic growth potential. So the types of IUGR, they can be two types, symmetrical or asymmetrical. The symmetrical IUGR has early onset and affects the head and the body equally. The asymmetrical IUGR, on the other hand, has late onset. It spares the head, but the abdomen or the body would be growth restricted. So common causes of IUGR, placental insufficiency, the most important cause, maternal hypertension, smoking, malnutrition, or presence of chromosomal abnormalities. How do you diagnose this condition? So basically, serial fundal height measurements, they will help in the diagnosis. Ultrasound is important for fetal biometry. Doppler studies, especially the umbilical artery analysis, will help you in assessment of the fetal condition. How do you manage these cases? Close monitoring with fetal growth scans, Doppler surveillance, and timely delivery, especially if fetal compromise is suspected. So you need to remember that early detection and appropriate timing of delivery are keys for improving maternal and fetal outcome. So that was all for this concept capsule. Here's a question for you. Thanks so much for listening, and now I shall see you with the next concept capsule. Stay tuned.